Most of us are aware of what's pretty good for our health, pretty bad for our health, or really good and really bad. We know that a so-called healthy diet, a good night's sleep, and wearing sunscreen can ward off some evil woes. We also know that much of our health outcomes is based on genetics, as well as many other factors not in our control. But what of the habits we can control? Is there a way to measure the burden of unhealthful habits as they impact the risk of cancer-related illness and death on a global scale? This past week, the Lancet published findings reported by the Global Burden of Disease Study 2019, elucidating which preventable risks impact both cancer-related illness and cancer-related death throughout the world. The study group, which collected data from multiple publicly accessible vital registry databases globally, analyzed both cancer-related deaths, YLL, or years of life lost, as well as cancer-related disease burden, DALY, or disability-adjusted life years, over the period 2010 to 2019. Cancer is the second leading cause of death worldwide, at least that was the case prior to the COVID-19 pandemic, when this research was carried out. Overall, risk factors such as tobacco use, alcohol consumption, obesity, and occupational environmental hazards accounted for over 4 million cancer-related deaths and over 100 million disability-adjusted life years, DALYs. This translates to over 44% of all cancer deaths and 42% of all DALYs being related to potentially remediable risks. The study authors sought to better identify where the mitigation measures could be better instituted globally, thereby better addressing means of reducing these risk factors whenever possible. In regions with lower socio-demographic indices, SDI, smoking, unsafe sex, and alcohol use were the three factors associated with the highest DALYs. In regions with higher SDI, smoking, alcohol use, and obesity were associated with the highest DALYs. Cancers related to unsafe sex were typically secondary to sexually transmitted infections such as HPV, human papillomavirus, leading to cervical, throat, and ano-rectal cancers, and hepatitis B and C leading to liver cancers.